It may be a change in behaviour or sleep, or they were walking and they're no longer walking. It may be concerns around a decline in vision or new onset seizures, a change in thinking or learning, which is going backwards. But at the core of it, it's progressive loss over time. Sometimes you see a family and initially the pattern is a delay in development. Really following families up and showing the trajectory over time that makes it clear.
One red flag in the beginning might be there's a child presenting with multiple significant issues across multiple body systems, and that might flag and say, oh, I wonder if there's something tying this together.
The diagnosis is individualised, and the basic principles are taking a history, a developmental history, asking for signs of regression, doing a neurological examination to look for neurological signs, and also assessing vision, hearing and thinking depending on the age of the child. And then based on taking those all together, it can be a series of investigations with blood tests, hearing tests, eye tests, urine tests, imaging like MRI scans, and now we're moving very quickly to genetic testing, and we have the capacity to look at a panel of genes all in one test. I always reassure them that if I'm getting results, that I will give it to them in a timely way so that I'm not sitting on it. I think having support through that diagnostic journey is very important, because even up to the point where you get the result, it's very stressful. So encouraging support from their families, their local networks, support networks, social work, counsellors can also be important.
Being really prepared in yourself and as a team. So families will often hang on to every word around the time of a diagnosis. So you've got to be really careful the language you use. I think to not rush, to make sure you're giving families the time and the space, and yourself as a team the time and the space. It's really important to almost provide a network for people when you're providing a diagnosis. So you really want to work together with your trusted colleagues as a team. So, with your nursing staff, your genetic counsellors, psychologists, other expert colleagues who know the family really well, might involve the GP as well. It really does depend on the setting and in the family, but you want to make sure that you're adapting to the family's journey, not adapting the family to your journey.
Planning that appointment so that you have enough time to be with the family and answer all their questions. It's a private room, and that you're not being interrupted.
Part of giving that news is them walking away from the conversation knowing what you're talking about. So it's not good enough just to say your child's got Batten's disease, full stop, end of story. Having some idea that this is a life-limiting condition, and what that is likely to look like for them for the next however many years is a very important part of that conversation.
I also realise that they often won't remember or understand a lot of the information because it's so emotional. And so providing written information and links to other resources is very important. And I think following up with families quickly as well.
And that might be more where you can think about, well, what else do we need to do in terms of getting this family set up for what's coming? And part of that might be making sure that they've got access to therapies, making sure they've got a general paediatrician, because sometimes that hasn't happened yet, making sure they've got NDIS kind of starting to happen, because it takes a lot of planning. Depending on what other problems the child's having, do they need a gastroenterologist? Do they need a respiratory physician? This is often, it's more like having a whole village looking after some of these families rather than one individual clinician. And I would like to fairly early on in the piece, get palliative care involved as well, because I think they're really useful in terms of trying to help these families, particularly with symptom management sometimes. So, and it also helps for down the track as things do start to unravel a little bit more, that they've already had that relationship from very early on.